Hi, everybody out there in internet land.
Welcome to Skin Deep with Dr. Amy Miller.
And that's me. I'm Dr. Amy Miller. I'm coming at you from St. Louis Skin Solutions here in St. Louis, Missouri. And this is Megan,
her trusty sidekick and person that helps run this practice. So we've also been sans wine for quite a few of our adventures because we were filming in the morning before patients.
But finally now we're back on our old schedule. So it's in the afternoon. We're done seeing patients.
Exactly. So today we are starting with a very lovely French Sauvignon Blanc. So it is a Touraine Sauvignon, and it is from the northern region of France. It is very light. It is very lovely. It serves well with goat cheese. It is not made with goat cheese.
Goes well with
goat cheese, not made with goat cheese. All right. So today, let's taste our wines. Cheers.
Cheers.
Before I get ahead of myself.
I like it. It's very mild and gentle.
It is.
I like a New Zealand Sauv Blanc. And that has those have a little more bite. Yeah.
Mm-hmm.
Or would that be acidity, I guess?
Yep, it sure does. Yeah, it has more of those acidic fruit finishes, but I think because this is so far north, you get more of that floral melon than you do the less acidic than the others. Coming up, we do have an Australian Sauvignon Blanc that we're going to try. I don't know when, but it's in the circulation.
Okay.
All right. So we've been chattering for the last year. 2 years, 3 years, while about peptide therapy.
Yeah, last couple of years.
Just kind of it was started to like him quietly mill around the big tirzepatide, semaglutide, weight loss, all those things. Started talking more about peptides. They become more of a common household name.
Right.
There's so many really exciting things coming down the pipeline for regenerative wellness, which is kind of where the aesthetic field is going, right? So we're going into wellness and longevity.
Right.
And I believe, if I'm not incorrect, that these peptides are going to be the thing that's going to kind of take us over the top for that, to help us get into that longevity adventure.
Bring us from not just looking good, but feeling good and being healthy at the same time and aging healthfully.
Right.
But peptides, as you know, are huge. With the weight loss peptides, they've really exploded onto the market. And they're all over. They're all over social media. They're all over TikTok. And it's kind of crazy how prevalent they are and how you can just go online and buy something. And
it's a little terrifying.
It is a little terrifying.
It's a little terrifying. So for people that don't know, that are kind of new to the whole adventure of peptides, what is a peptide?
Okay. So a peptide basically is a small protein.
Okay.
So amino acids, there are 20 amino acids, 9 of which are essential that we have to get through our diet. But these 20 amino acids act kind of like Legos, building blocks, and they make chains. And you put 2 or more in a chain and you have a peptide. When you get a really long chain of 50, 100, 200 amino acids, you get a protein. And then the proteins can get so long that they start folding over and becoming 3-dimensional shapes and whatnot. But a peptide is simply a string, like a string of pearls, a string of amino acids.
So they're found in every day?
They're all there. We have them in our body. There's something like 7,000 of them known and just more to be discovered. There are actually 60 that are currently FDA approved to use as medical treatments.
Okay.
The most famous of that is insulin. So peptides have been around since the 1920s when insulin was developed.
Oh, wow. I didn't realize that insulin was a peptide.
Yes, indeed.
That's kind of cool. So the kind of where I see the common types and applications of these peptides are going to be in medical and weight management, in skincare,
right?
Fitness and recovery.
Yes.
And nutrition.
Yes. And brain health is another one.
Okay.
That's a big one because of dementia and Alzheimer's and the scary things that happen with our brains as we age. So there's several promising peptides that can decrease neuroinflammation and help with cognition. Those are not FDA approved. They're not available right now. In fact, many of the ones that are talked about and really famous on the internet are not FDA approved.
What does that mean?
So what does that mean? That's a really good question.
Yeah.
So are they illegal? No, they're not illegal. The DEA, the Drug Enforcement Agency, is the federal agency that regulates controlled substances. So if you have a controlled substance without a prescription, then you are in possession of that drug illegally. Right? So the DEA has no purview here. They don't care about peptides. It's more the FDA.
Okay.
So the FDA, the Food and Drug Administration, is who approves drugs for use in the United States. Right. And so you have to do a lot of testing, a lot of research. You go through phase 1 through phase 3 and phase 4 trials to get FDA approval, and it's very expensive.
Oh, yes. Well aware how that all works.
So the FDA has decided that some of these peptides, which had been available, which you could get through compounding pharmacies, did not have enough efficacy and or safety data. So in late 2023, they took them off the okay to compound list or okay to make and put them on the do not compound list.
Okay.
So for a couple of years, we've had our hands tied. And what's exciting is hopefully they're going to take some of those off the do not compound list.
Awesome.
There's theories about which peptides those are, but we don't know for sure. We won't know till it happens. But there will be some more freedom as for accessing those peptides legally and safely. The thing is, they're available on the internet. You can get them from China or from somebody's basement lab, but you don't know what you're getting.
Right.
And that's kind of
scary.
Yeah.
That's scary when you're buying something that you're going to put in your body that you don't know what it is.
Exactly.
It takes you back to the stories that you hear about people going into somebody's backyard and getting tire silicone put into their bodies for a butt lift or a breast dog, and you just don't do things like that.
Embolism, something like that.
Don't do things like that, friends. That's a really bad idea. So peptides are designed, or they do things like make you feel more energetic. They help with the gut health. They help with kind of the weight loss. Peptides are slowing down that absorption. They're quieting that food noise. So there's a lot of talk out there in the medical world about how the peptides, especially the weight loss peptides. I just was watching something this weekend on the news about, like a 60 Minutes, about how long-term use of peptide therapy is going to kind of become the purview, kind of the natural thing to do, like going to the dentist, getting your tox.
Yes. Yeah. I believe that, especially those weight loss peptides, the GLP-1 and the GIP. There's so many more benefits that we're discovering as we're using them more, that it brings down inflammation. And that has so many effects over all body systems and all disease progression.
Right.
So I really believe in 30, 40 years, it's going to be something that we all do regularly. It's going to be like Prozac. It's going to be in the water.
In the water.
No, but what I'd like to say, too, with peptides is peptides are a little bit different than drugs.
Okay.
So when you take a drug, you're forcing a pathway. You're forcing the body to do something. So say like a diuretic, like hydrochlorothiazide. You take hydrochlorothiazide, it stops the kidney from reabsorbing sodium. Sodium is excreted, and then the water follows, and you have your diuresis, right? So the kidney has no choice. What peptides do, they don't force things. I like to simplify it. I like to think of it as they're making suggestions.
Okay.
They suggest to the body or to the cell things to do, or they modulate. So they don't push things over the edge. So they have a lot less side effects.
Okay.
So they're not forcing things to go in ways that are unnatural. They're suggesting it. If the body doesn't want to do it, it's not going to do it.
Right.
And that's part of the reason some people don't respond to peptides. There's all over the internet, there's BPC 157, which is a healing peptide, and there's miracle stories about it. But some people just don't respond to it. And why is that? Well, is their body not listening? Do they not have the building blocks they need to do the healing? Are they not in a place for the BPC 157 to actually make a difference? They may not be healthy enough.
Okay.
There may be other things going on. So with the peptides, it's important to remember that it's icing on the cake. It's not the thing. It's not the drug that's going to force something to happen.
Right.
You have to have your hormones all in place. You have to be eating right, sleeping well, doing all that stuff, taking care of yourself for them to work most efficiently.
Yeah, absolutely. That's a great point of like making sure that you're healthy.
Right.
Like this is not a cure.
Right. It's a lot of them are more lifestyle types medicines. They just help you feel better. The growth hormone secretagogues are probably the most famous of those. They give you more energy. They help you create lean muscle and reduce visceral fat, things like that. But once again, if you're going out and eating pizza every night and drinking a lot, those growth hormone secretagogues are not going to work as well.
Right. Well, one of the other things that we talk about all the time is collagen.
Right.
We talk about how as women age, we stop producing healthy collagen and elastin, and we have to trick our body into remembering to do that, like postmenopausal, as we head into perimenopause, postmenopause, our body stops producing collagen naturally. One of the big things that we talk about is collagen induction therapies.
Right.
So we talk about that through an oral collagen. We talk about that through microneedling or different laser treatments.
Energies to the skin.
And to the skin. So yeah, all those things.
And one peptide that's going to be beneficial in that arena is the copper peptide. So it's a 3 amino acid peptide that copper is attached to, so it helps drive copper down into the dermis. Copper is a substrate for collagen production, so it can help with that.
So can the copper peptide, there's talk about copper peptide topically.
Yes. So I always get a little wary when you say, oh, we put it on topically, it's going to get in. The skin, its main function is a barrier. It's meant to keep things out.
Right.
So I'm always a little suspect of that. But copper peptide is such a little tiny molecule, like I was saying, that if anything had a chance of getting in, it would be that.
Right. Yeah. Which is why FDA in 2023 said no more.
No more. You can't inject it.
Yeah.
Now we can use it topically.
Right.
And sometimes to enhance that penetration, we can use it with microneedling.
Okay.
So it can get down a little deeper
into the dermis.
The skin. Yes. Yeah. And that can be quite helpful.
What other peptides do you think are going to be, do you know? Maybe we don't know the answer to this question yet, so I could be asking this question prematurely. What do you think we're going to be bringing in? What do you think are going to be at St. Louis Skin Solutions that you feel would be the best for our patients?
Okay. Well, we already are doing the weight loss peptides.
Correct.
So we already got them on board. I think what goes hand in hand with that would be the growth hormone secretagogues.
Okay.
Those help with, once again, visceral fat reduction. That's the fat around our organs. That's internal. And the more you have, the higher risk of mortality and morbidity as you age. So getting rid of that, putting more lean muscle mass on, that just goes hand in hand with the weight loss peptides. The other, of course, the copper peptide. The other one, I think, is going to be the combination of the BPC 157, which is a healing peptide, and thymosin beta 4, or TB 500 is what it's called, and the two combined are called the Wolverine blends. Yeah, and they combine that with the copper peptide, and you really got something for skin rejuvenation and regeneration.
Very cool. What's the best route of getting? What's the best route of, come on, help me here.
I know what you're trying to say.
Like transdermal, injectable method of getting it in your system.
I'm going to think about it the minute we're done filming this.
Exactly. But what's the best way for
get it in the body?
To get it in the body.
Well, okay, so that's the thing with peptides. They are strings of amino acids, protein, right? So if we just take them orally, your body's going to break it down like it would a piece of chicken or any other protein that you eat and absorb the amino acids separately. So they're not great orally. Now, there are a few that you can take orally, and they've been engineered in the lab to protect them from the acidic environment of the stomach. But a lot of times you have to get enough absorbed. You have to give 50, 100 times the dose, and it can be quite messy. So oral is not the best. Right now, injections, sub-Q injections are the way to do it. A lot of times you do it 3 days on, 3 days off, 5 days on, 2 days off, and you do it in cycles for 3 or 4 months for your healing peptides. Some of the neurocognitive peptides can be done through a nasal spray because with the olfactory nerve, there's a direct connection to the brain. So you get it in the nose, you can get it up to the brain pretty easily. There's something called KPV, which is, once again, that's a 3 amino acid peptide. Topically, it's a very powerful anti-inflammatory, and it can work for psoriasis and inflammatory skin conditions. I have yet to find a pharmacy that can make it in a topical form.
Okay.
So I'm hoping that'll be one that gets loosened up and we'll have more access to it. I have a feeling, though, there is some political machinations behind the peptide
releases or
holding, because they do work,
right?
And they're banned by WADA, the World Anti-Doping Association. So if they're banned, that tells you they do something.
Right.
So they do work, but they can't be patented because they're occurring in our body.
So there's no big money in it.
Bingo.
Big pharma.
Yeah.
Not going to like it.
And if these were suddenly all available, maybe we wouldn't be running to big pharma for their other medications. Just a thought. Don't want to get political here. We can't prove it.
Just a theory.
Just a theory.
Just our theory, not anybody else's theory. So, side effects. Do peptides have side effects?
Well, anything does, but compared to drugs, side effects are much less.
Okay.
Now, you can always have side effects. The growth hormone secretagogues have growth hormone-like side effects, especially if you get too high a dose.
Right.
And when you look at the literature on problems with the peptides, it's always because the patient accidentally or on purpose took a huge dose.
Right.
Took 50 to 100 times the dose that they should be taking. And of course, you're going to have side effects.
Sure.
I mean, you do that with any medication, you're going to have problems.
Absolutely.
But straight on compared to drugs, they have less side effects.
Who are peptides not for? If somebody came in here, what reasons would you say, I'm so sorry, that's not something I'm willing to offer you? Because we do that sometimes. We do tell people no thank you.
Well, first of all, if their hormones are a mess, you got to get those straightened out, because peptides aren't going to do anything until those are in balance. And, you've got to get the good exercise and eating right and trying to get enough hours of sleep, that kind of thing. The one thing that really jumps to mind, though, is anybody with an active cancer or active growth. Because
that makes sense.
Yeah, these peptides stimulate growth. They, a lot of them stimulate angiogenesis. The BPC-157 stimulates angiogenesis. You get more vascular flow to the area, so you can heal the area. Well, you get that in a tumor, and that's not good news.
Right.
So no active cancers. If it was somebody who's had cancer in the past, 10, 20 years ago, it's something we'd have to sit down and talk about and together decide.
Sure. Whether that's appropriate for them or not.
The risk ratio, whether it's worth it. Yeah.
What about pregnancy?
Avoid it. Pregnancy.
Breastfeeding women.
Just avoid it. Not worth it. They'll be done soon enough so we can get to it.
Well, these are just the questions we get, right? So I always try to think about, what are people going to ask me in a treatment room? What are they going to say to you when you're having those conversations with them? So, just trying to give these friends out there in internet land a good little bit of education as we kind of dive deeper into this. So this is just kind of our, dip our toe in. We're just going to tell you a few little things. Then we're going to really dive deep, and we'll probably do a whole series on the different peptides that we're bringing, and we'll probably release the podcast as we release the peptides.
Yes.
So stay tuned. There'll be a lot more coming down the pipe from us about peptides and how we're going to use it in our practice and how we're going to partner with you, our friends, to make you feel better.
Yes. And we've been trying some peptides out.
Yeah.
I always try everything out myself and have staff try it out before we ask patients to do
Guinea
it.
pig adventures at
Yes.
St. Louis Skin Solutions.
So,
it's a perk.
Yeah. Well, most of the time. But I can tell you on the top of the list, probably the growth hormone secretagogues, and 2 of those are FDA approved, so we can start doing those right away. Samorelin and tesamorelin.
Oh yeah,
So those are we would be using them off label, but we can get those through the pharmacy. There's no problem with that.
That's what we've got.
And then the one that I've been trying that I really like, it's called melanotan 2.
Yep.
Yes, and that helps with pigmentation without UV exposure.
Mm-hmm.
There are other things it does as well, but I'm going to leave that as a teaser, and we'll talk about it later.
I see how she's playing this game.
Yeah. Yes.
Any closing thoughts, remarks, or otherwise about the intro to peptides?
Not that I can think of.
Stay tuned out there in internet land. We'll be back with version 2, 3, 4, 5, 6, and who knows what comes beyond that. So until next time, if you would like to reserve a consultation, you can call us at 314-394-3915, or you can go onto our Boulevard app right from our stlouisskin.com, reserve your appointment for a consultation. Can't wait to see you in the office.
Bye.
Cheers.
All right.